आदाब, good morning, good afternoon, and good evening. जहां से भी आप हमें सुन रहे हैं, thank you for joining our live session. My name is Kunjan. हमें आपकी host और दोस्त for today's live session. Okay? So if you are joining us right now, we are in conversation with Dr. Anupama, and we are trying to understand the importance of kidney health. So my first question, I'm going to start with a very basic question. What is kidneys function? Like someone like me who does not, who doesn't have a who doesn't have a medical education, what is kidneys function and what is it actually doing and where is it located?
Okay, so all of us are born, hopefully born with two kidneys. Sometimes you don't know you can be born with one kidney, but usually they are bean-shaped organs that are in the lower part of your back. The most important function of your kidney is to remove waste products from your bloodstream and to remove excess fluid from your bloodstream so that it keeps all your electrolytes and your fluid status in balance.
Let me ask you, what are some risk factors for developing a kidney disease and how it can be managed?
The important risk factors are diabetes, hypertension, age greater than 60 years, anybody with heart disease, family history, and obesity. All these are the most important risk factors.
How can I tell or deduct an early signs or symptoms that either me or someone I know is actually suffering from a kidney disease?
Okay. So most of the time, unfortunately, chronic kidney disease, about 850 million people worldwide have chronic kidney disease, and about 90% of them are unaware that they have chronic kidney disease. And that's why it's called a silent killer, because you don't have any symptoms in the initial stages. So you may be completely unaware that your kidneys are not doing very well. So it's usually deducted when you when you go for your regular blood test or your regular exam to your doctor, like your general physical exam that you go for, your yearly exam, and your doctor does blood tests. On the blood test, they may show an abnormal level called a creatinine, or your urine, they check your urine and there may be protein or blood in the urine. And this may be done as a part of your physical exam, or it could be just done due to an unrelated disorder. You may be going for something else as a checkup and they check your blood and then it's deducted on that. Or it could be deducted on some imaging test, like you go for a radiological test or a CT, an MRI or X-rays or ultrasound, and then they see cysts in the kidney, or the kidneys, the size of your kidney is small, and that it is also an indication that you may be suffering from chronic kidney disease. So initial stages, you have no symptoms whatsoever. About 90% of the patient, like I told you, have no clue that they have kidney disease. So it's usually on a blood test, urine test, or an imaging test that we usually deduct.
I have heard a term which is hypertension. So how is hypertension managed in the people like you called CKD, and what medications are commonly used in circumstances like these?
Okay. So hypertension in layman's terms means high blood pressure. Your blood pressure is very high, and that's called hypertension. And hypertension is the second most common cause for developing chronic kidney disease, diabetes being the number one worldwide, and hypertension is the second most common cause. And 1 in 5 patients who have hypertension can develop chronic kidney disease. 1 in 3 diabetic patients can develop chronic kidney disease. So hypertension, when there's very high blood pressure within your blood vessels, it affects your body from head to toe, including your kidneys. So there's a lot of pressure in the blood vessels that builds up. And what happens is it stiffens the arteries, it constricts the blood vessels, it narrows the blood vessels. So as a result, what happens is when your blood vessels are narrowed, the amount of blood that goes into your kidneys, because remember, your kidney is purifying your blood of all the toxins every second, every minute of the day. So the amount of blood that flows through your kidney is how much your blood gets purified. So if your arteries and your blood vessels are stiffened, then there's less blood flowing through your kidneys to get purified. So what happens is the toxins get built up, and then the fluid get built up because the kidney helps to eliminate toxins and excess fluid. So when those two things get hampered, then the toxins waste products get built up, the fluid gets built up. That in turn causes more pressure within the blood vessels. That raises your blood pressure further. So it's kind of a vicious cycle, and there's sort of a downward, spiraling from there. So in patients with chronic kidney disease, the mechanisms that are involved in in developing hypertension are, it's usually sodium retention, salt retention, because the kidney is the main organ that excretes salt out of your body. So if you are not able to excrete that salt out effectively, then the sodium the salt gets retained, and that thereby when you retain salt, it actually attracts fluid, it attracts water. It does not let the water go out. So that, when the salt and water build up, that raises your blood pressure. It also, there's another way that blood pressure is manifested in chronic kidney patients. The kidney, because it's it's not working 100%, it starts producing certain hormones, and that's called renin and angiotensin system. It gets upregulated and it produces a lot of the abnormal hormones that raises your blood pressure as well. So as a result, when we treat patients with CKD with medications, we're taking into consideration all these factors and then choosing the appropriate medications based on the individual. What is it that the individual is coming with? Like, let's say a patient with CKD comes to see me. And then the most important thing is three things that I always look for in the patient, pay a very close attention is, we take a very good history of the patient. What is your, what are you eating? What is your diet consist of? Is this patient eating mostly processed food? Is this patient eating mostly outside food all the time? They're eating less home cooked meals, but rather eating a lot of processed food, fried food, salty food. And then I look at, I examine the patient. When I examine the patient, I see, I'm looking for, is there any fluid retention? And fluid retention is usually on exam, it is evidence as swelling in your legs or swelling in your, in any part of your body, wherever there's loose tissue, or your weight has gone up. If the patient says, oh, I'm rapidly gaining weight, then that is sort of an indication that maybe they're retaining fluid. And then the other thing I look at is the blood test and the urine test. Is the urine has a lot of protein in the urine, or if there's a level called a creatinine on your blood test that's getting worse. So all these things, I look at it. And then what I choose, the medications that I choose for this patient will be, I usually start with two medications, maybe a water pill, which is called a diuretic. A diuretic, what the kidney is unable to do because it's failing, that diuretic or the water pill will help the kidney by eliminating the salt and thereby pull the water out. And that restores, the normal fluid balance in your body, thereby bringing the blood pressure down. And the other medication that I would use for these patients are called ACE inhibitors, which is the full form is angiotensin converting enzyme inhibitors, or ARBs. So these two medications, these classes of medicines are specifically important because they decrease the blood pressure within the kidney, not only systemically, but within the kidney itself, and they help to decrease the protein spillage. So this patient coming in with protein in the urine and a lot of fluid retention, when a combination of these medicines are given, that will help to decrease your blood pressure in a better way than just choosing one medicine. So that's why in patients with chronic kidney disease, when it involves multiple medications from different classes of antihypertensives. So it's not just one size fits all kind of a medicine, and one medicine will work better for one patient, and that may not work better for the other one. So it's a combination of medications include we choose based on the history, the lab data, and the exam.
How frequently should my kidney function be checked?
It depends. I mean, if you don't have any kidney, if you've already been diagnosed with chronic kidney disease, it depends on what, like I said, the eGFR is used to, depending on that, we have 5 stages of kidney disease. So when the eGFR goes lower and lower, the kidney function is worse. So it starts off at 90% and it goes up to 15%. So less than 15%, that's when patients have very poor kidney function. And if it is, most of the kidney patients that we see are in the stage 3, where it's between 30 to 60%. That's a wide range. So it depends on what stage of kidney disease you're in. So if you're in a very early stage, depending on how well you're maintaining your diabetes, your blood pressure, how well it's controlled, you can perhaps go every 6 months or even a year if things are okay. But if you are developing, if your kidney function is rapidly declining, you have very poor control of your blood pressure, your diabetes is not well controlled, then you probably perhaps may need to see your doctor, until your blood pressure is well controlled, perhaps every 6 weeks or 8 weeks to manage, to make sure that your blood pressure is well controlled. And once it's stabilized, then they can, you can probably go every 4 months, depending on how stable your kidney function is. So it's very hard for me to sort of pinpoint and say, this is exactly how many months you have to go, because it all depends on what stage and how well your comorbidities, the other, which is affecting your kidney function, is controlled.
How does hypertension contribute to the progression of kidney disease? And can we prevent it or slow it down somehow?
So like I already explained to you, the hypertension, it causes a lot of pressure within your blood vessels. It narrows your blood vessels in the entire body, which includes your kidneys. So less blood flow is flowing into your kidneys, and then, it retains fluid, it retains salt, thereby raising your blood pressure further. That puts more pressure on the kidney and thereby causes the kidney to deteriorate and your GFR, the eGFR, to deteriorate rapidly. Unfortunately, you cannot hypertension is, yes, if you have a family history of hypertension, you may be genetically predisposed to have hypertension, so you may not be able to completely avoid it. But on your part, you can do certain things to control your blood pressure so that it does not cause damage to your other organs in your body, which is what we call as end organ damage. Hypertension can cause damage to other organs, end organs like your brain, your blood vessels, your eyes, your heart, your kidney. These are called end organs. So we want you to prevent that end organ damage. And by the way you do that is, of course, if I'll focus mostly on chronic. I'm not going to speak widely about hypertension, but in chronic kidney patients, let's say you develop hypertension, you first are diagnosed with CKD, you may not have, your pressure may be okay in the beginning, but then your doctor notices that your pressure is slowly worsening, because chronic kidney disease can itself cause hypertension.
So what are some complications of kidney disease? Like, do we have any bone loss or blood loss, or people become anemic? So shed some light on that.
When you have chronic kidney disease, we focus mostly on your blood, removing the waste materials. What the kidney does, the two most important functions are to remove waste materials and to remove excess fluid. But the kidney is very, complex. It's got several other important factors, important functions as well. It maintains your the electrolyte balance in your body, the potassium, the calcium, the phosphorus, vitamin D. It also helps to produce, the kidney produces a hormone called erythropoietin. So that helps to stimulate your bone marrow to produce red blood cells and maintain your hemoglobin, in a normal range. So that's why patients who have chronic kidney disease, they have decreased erythropoietin secretion. The hormone from the kidneys decrease, and thereby there's less stimulus to produce the red blood cells. So you're using up your red blood cells at a pace, but it's not able to produce it at the same pace. So invariably, kidney patients become anemic. So that's another, a complication of CKD. And of course, the the most important complication is also cardiovascular diseases. They are very high risk for cardiovascular disease. And then in the very, end stage, when kidney, like, as I said, 97 at the very end stage, when the toxins start building up, then you can start having other complications like, anorexia, meaning poor nutrition. You don't have an appetite to eat, so you lose weight. Your albumin or your protein level in your body goes down. You become uremic, which means that your cognition is you're not able to think properly. You sleep a lot. So all these things are that happens with different stages of kidney disease. They may not happen all at the same time, but it's it progresses as the GFR or eGFR declines over a period of time.
Yeah, what if somebody is anemic? Does it mean that they have CKD or they are at risk?
No, anemia is not actually a risk, but anemia can perpetuate chronic kidney disease. The patient already has chronic kidney disease, and then if you become anemic, like I said, chronic kidney disease itself can cause anemia. But let's say you're anemic due to other reasons as well. You can have other reasons that you can be anemic, but that can rapidly progress, perpetuate the progression of chronic kidney disease, because when you're anemic, you have low blood flow. So there's decreased blood flow to your kidney. So the kidney is already not working well. And on top of that, if the blood flow is decreased, the nutrients are not reaching your kidney and thereby cause more kidney loss.
Next question, we have heard the word, or at least I have heard the word kidney dialysis. So how does it work to support the kidney function?
So the end stage of the chronic kidney disease, as we progress, from stage 1 to stage 5 in chronic kidney disease, stage 5 is when patients' kidney function, the percentage is less than 15%. Your kidney is working less than 15%, and that is called end stage kidney disease. So when you reach that stage, there's really nothing, no medications, it's irreversible. The damage is irreversible. You can't do anything when you reach that stage. So you're kind of, the treatment at that stage is, especially when patients start developing symptoms of, end stage kidney disease, is to do dialysis. Dialysis is nothing but, it's a modality that we use that works like your kidney. So you're attached, it helps to remove the toxins. Whatever your kidney is not able to do, dialysis does that. It removes the toxins from your body, it removes the excess fluid from your body. So it is a modality that we use to replace, your kidney function in the patient.
So is there like a duration, or what kind of factors help you as a doctor and the patient to decide that which kind of dialysis is best for them?
So, when we see patients, it depends the modality of dialysis, what kind of dialysis maybe is suitable for a patient. It depends on lots of factors. Is the patient young? Is the patient working? Is the patient very old, debilitated? Is the patient needs a lot of help? Is he cognitively inclined? Like, is he able to think or do things for himself? All these factors we take into consideration and then kind of choose the modality. So for patients who are, very young, who are intelligent, who are able to do things for themselves, they are very independent, they work. If you want to choose something that does not, hamper them to continue to work, the whole idea is for us to help the patient to remain successful, to patient remain independent, patient to, continue to work and lead as much as a normal lifestyle as they can. So in those patients, we may choose something that they don't have to come to a center to do dialysis, that we choose a home modality wherein they can do it at home in the night, called peritoneal dialysis. Like I said, we have, it's a catheter that we place in your abdomen, and then they hook it up to a machine at night. And during the night when you're sleeping, the dialysis is taking part, and they unhook themselves, go to work in the morning, and they can travel with this small the machine. So all the thing. There's another modality called home hemodialysis, which is a different kind, wherein it's the same thing. There's a machine that, but in that modality, the patient does at least 4 times a week. You do dialysis in short sessions, like 2.5 hours or 3 hours. You hook yourself to a machine and do dialysis.
So, It's a wrap. So eGlobalDoctor is one complete healthcare platform solution for all your medical related issues and questions. And maze ki baat hai, you have these services available to you at your fingertips without breaking your bank balance. You don't even have to drive. Just at the comfort of your home, you will get all the services. So, Dr. Anupama, this was enlightening for me. I'm sure it was the same for our viewers and listeners. Do you want to condense or summarize the session so that, whoever is joining us now, they were not able to hear the prior part, they know how important it is to maintain a good kidney health?
Okay. So chronic kidney disease is when your eGFR or your function of your kidney is less than 60%, or you're having protein in the urine of more than 30 milligrams per day. Usually 90% of the patients are unaware that they have chronic kidney disease, because that's why it's called a silent killer. It's usually when you check your labs that it's evident that your kidney may be abnormal, either based on your protein in the urine or based on your creatinine level, or imaging tests that may show that your kidneys are not looking well or healthy enough. So that's why if you have risk factors like diabetes, hypertension, age over 60 years, you have any kind of cardiovascular disease or family history, make sure that you pay attention to your kidney function. Talk to your doctor about your creatinine level, about the protein in the urine. Be your own advocate of your own health. So if you are diagnosed with chronic kidney disease, it's not the end of the world, because all these risk factors play a role in progression of the kidney disease. So if you take utmost care about your blood pressure control, about your diabetic control, your weight, exercise, quit smoking, decrease alcohol intake, all these things decrease your risk of progression of the kidney disease. So you may not, so once the kidneys scar, unfortunately, they do not revert back to normal, but at least you can prevent further progression so that you don't end up having end-stage kidney disease wherein you need dialysis. So the very important that is, I think lifestyle factors, lifestyle modifications are not emphasized enough in this, especially as we become more and more sedentary. Everything is at the tip of our fingers. We order things, we sit in front of the computer and we order everything. We hardly walk, we hardly, we are not active. So that has played a major role. Obesity has become an epidemic in perpetuating diabetes, high blood pressure, and thereby chronic kidney disease. So, please pay attention to that, because that is really, I cannot emphasize enough how much lifestyle plays a very important role in preventing further progression of the kidney disease. So, but let's say you do develop end-stage kidney disease, nowadays we have different modalities of dialysis. You can do it at the in your home, so that way you don't have to go to a center. But even if you go to a center, we still have the modalities are very safe. You can still lead a very a healthy lifestyle. You can still be productive, go to work. So that's not the end of the world. And of course, if dialysis, if you have a person who can give you kidney transplant is also an option. So if you have a loved one, if you have a family member, if you have friends who are willing to give you a kidney, that will be the ultimate, best outcome you can get, because you're now having a healthy kidney and you become a normal functioning, your kidney is normal and you're not on dialysis. So you have options. So it's not the end of the world, but you don't want to go there. If you can prevent it from the beginning, that's what we are, that's why compliance is very important. Going to your doctor, taking your medications. Just because you take medicines and your blood pressure decreases doesn't mean you need to stop taking medicines. I hear this all the time. The patients say, oh, my blood pressure got better, and that's why I stopped taking the medicines. Well, the reason your blood pressure got better is because you were taking the medication. You stop, it's going to go up again. So once you have chronic kidney disease, once you have hypertension, once you have diabetes, it doesn't get cured. It's a chronic problem. So you have to take medications every day. There's no cure for this. It cannot be cured. It can only be controlled. So that's why pay close attention to your comorbidities. If you have a elderly parent, if you're a, if you are a, see what their, their comorbidities are, and look at their blood work, and have a chat with your primary care physicians about whether you have risk factors, whether you need to get tested for kidney problems. You take care, please take care of your kidneys, and they will definitely take care of you.
That's wonderful. Take care of your kidney and they will take care of you. I love that. And like Doctor mentioned, please listen to your body. It will tell you if you are paying attention, what needs to be done. This was definitely an eye-opener and wonderful session, Dr. Anupama. I learned a lot, and I'm sure our listeners, got a lot of information as well. So with that, this is Kunjan signing off. Sayonara. Stay tuned till we meet again. Keep smiling and stay safe. Namaskar.